Hi, I'm State Senator Tony Hwang, and I'm here with two absolutely fabulous heroes in regards to the world of caregiving. We have Juliet Bronder, and we have Miss Eleanor Wilbur, former state representative. And these are two fabulous individuals that will share with you the stories of being caregivers to loved ones that are impacted, have been impacted by Alzheimer's, and how important the respite care program is to their continued health and how important it is in regards to potential savings down the road. So, Juliet, if you could share what does respite care and being a caregiver means to you and your experience.
Well, caregiving. My husband was very young when he got Lewy bodies dementia. He was diagnosed in his early 50s, and we had three children in college at the time, and our life was going along beautifully. And suddenly he had problems remembering what he was supposed to do, and he got fired consecutively. This is a man with several patents, 3 degrees, and he was losing jobs. And we didn't know what was going on. And then finally he was diagnosed, and it was Lewy bodies dementia, which is the same plaques that are in Alzheimer's in the brain, but with a Parkinsonism underneath. So his gait and his movement was difficult, and he started falling down. And then he became incontinent rather quickly into the diagnosis in the first year. And then he became unable to walk. And then every day was a serious struggle getting him into the bath. He was afraid to get into the shower, and I had to try and maneuver him into the bath, and he pulled. He was very strong, very fit. And finally, one night he fell down the stairs. It was the day of New Year's Eve. And I had a friend coming up from New York City, and she said, "You've got to get him into a facility." He had injured his shoulder, and he had landed on his head, and he was past the point of me being able to look after him. It took me nearly all morning to get the bed and the bathing done, and I was really going down with my husband, which happens to people who look after somebody with dementia. The person, the caregiver, can very quickly fall into some state of ill health or depression along with the person suffering from the disease. And finally, we had him put into a nursing home, and I decided after he went into the nursing home, I said, I've got to do something. I'm still young enough. And I heard about the Alzheimer's Association and got to meet people from there. And while we were there, I met Eleanor and a couple of other people, and we got together and we formed a public policy committee, and we said, what can we do for the caregivers? And at the time, we're talking about a few years ago, Connecticut was 49th out of 50 states in the amount of money it spent on home health care or services in the home for people who were disabled. And we said, we've got to put a bill in, and we got Senator, at the time, Senator Gennario, and came up with a proposal. And in the short year, we got the bill passed for a respite care program. We wanted 2.5 million. I think we got 1.5 million, but we were so happy we had it under its way. Yeah. So now it's been going, 17 years, right.
How long did you care for your husband?
I cared for my husband for from the time of diagnosis till the time where he was for about 3 years.
And how long ago was that?
That was in the early 90s.
How did you feel when you finally reached the point where you felt that you could no longer do it and you had to put him into a home? How did that feel?
It was very it was very sad. I didn't want to not look after him, but it came to be a very big physical strain because of lifting him. Because by this time he could barely walk, and he would fall over flat on his face, and he didn't have the instinct to put his hands out, and he would split his cheek open, and of course, even though I was using, very heavy grade diapers, the bed would always be soaking wet in the morning, and then that had to be changed every day. And then it was just, I couldn't get out of the house to go and do normal, and my children were all away. I had one daughter in New Zealand, I had one son out in California, and another one up in Ithaca. But it was the friend who persuaded me. And we had to call on the 31st of December. My neurologist was away skiing, but we did get him into a hospital situation.
And you've not had to care, and it's many years past. So explain to me why you made the trip to come up here today when it's an issue that doesn't immediately impact you.
Well,
but one of the things I've heard is the fact that caregivers themselves right now can't come up and provide this kind of advocacy.
Right.
So you're really doing this by your own experience and wanting to help those that can't speak.
Well, when I see cuts in a budget, which is not very large to begin with, and I realize that if the caregivers do not get the money that they need to at least have a break, they are likely to put their person in a nursing home much quicker, and then if they're under a certain level of income, the person will be immediately on Medicaid, which the state is going to have to pay for at a much, much higher rate. We're thinking $6,000 a month that the state pays, the average monthly pay for Medicaid per patient, and that's $72,000 a year average. But for the respite care program, the person can get up to $7,500 a year, but the average is $3,000, and it can be lower than that.
And the care is incredible. The money spent goes so far.
It does.
In being able to give some relief.
Yes.
So I want to thank you for coming up. I'm going to get Eleanor. Yes. Eleanor Wilbur, former state representative, and someone that I've gotten to know for a long time because of your public service. But you were the person that really brought it to bear for me in talking about how important respite care, that in your health status, that you had to care for your husband and how important respite care was, and how I picked up that line from you.
That's right.
How the caregivers don't always have a voice because they are so consumed, so exhausted, that they're not up here, and we need to really speak for them. So,
well, they're not only exhausted, but they're also the caregiver and can't leave. So it's really that they're trapped with the situation. Just to give you an example of how trapped you can be, when my husband was before he went to the nursing home, which he did do in the end, which I think most Alzheimer's patients probably have to do. Before that, in order to get some sleep, I would lock him in the bedroom with me, and he would pace the floor, and I would sleep. The only way to be safe, for him to be safe, was to lock him in the bedroom. So, I mean, it's very complicated being a caregiver for a person who has Alzheimer's, because they don't know what they're doing half the time, or if they make a decision, they do something which endangers them. They have to be watched almost constantly. And when I was in the legislature, he began to show signs of Alzheimer's disease, and I had to leave the legislature in order to stay home and take care of him, and which I did for 2 or 3 years. But in the end, it was a nursing home like everybody else. And we're convinced, although I think there's no real way to prove it. We meaning the Alzheimer's Association and those of us who have been through this, we are convinced that every dollar that's spent for respite care probably prevents a certain number of weeks, months, years, I don't know, of keeping a patient at home, where the care is much less expensive for the state than Medicaid, as Julia has pointed out already. That's more or less everybody's story too. The people that are not here testifying are those people who are staying home taking care of somebody.
As a caregiver, Juliet talked about how her husband's size and weight and how difficult it was and how uncooperative. You had to care for your husband from the chair. And how did you do that? And I think you said that, you explained it to me, and that's why I'm such in awe of you. You have this New England realism that you say, you just have to do it.
That's true. You do.
And sometimes a lot of people don't understand. There comes to a breaking point.
Yes, well, I think almost everybody who cares for someone with Alzheimer's, if it goes on long enough, does come to a breaking point. Because, in fact, the disease is progressive. There's no turning back from the disease. And it's going to get worse. And, in fact, it is a fatal disease, which most people, I think, don't understand. They think it's simply dementia. It is actually a fatal disease, and the person deteriorates physically and mentally, both. The whole body breaks down. And then in the end, most people who have Alzheimer's can no longer swallow, for example. And so they haven't long to go.
Well, I think we're talking about Alzheimer's Respite, and both of you bring an interesting story. But the AARP has really initiated a program to really bring out caregivers as a whole.
Right.
And I think you said the line over and over again, and I think you also shared with me why this respite program and so many of the caregiving programs continually get cut every single year. Because I think you both said it well, and you said it the best, I'm biased to you, Eleanor, is the fact that advocates, caregivers, cannot come up to tell you these stories.
That's correct.
And how important is it for you to have an opportunity to tell the legislators and to tell the public that this is a potential healthcare needs crisis in our community?
It is true. It's not just true of Alzheimer's, of course. There are other diseases which involve caregivers, and they can't come either. But I have to tell you that the first time we had a hearing here, one woman came. It's a story that I've repeated before. One woman did actually come to testify. She was blind, and she took care of her husband. And this is the third time she had been out of her house in 3 years. The other 2 times were to see the doctor. This is when you think about what that means to a person, that they can't leave the house, they can't see, they can't. The only times they go was to see her eye doctor, of course. It was just it's a story that most people probably don't even believe. They just think, well, she was probably not. It probably couldn't have been that bad. It is that bad. It is that bad.
But for both of you, if you have an opportunity to share with legislators that are evaluating this on a budgetary basis, here's an opportunity. What would you say to them?
I think the most practical thing to say to them is that sooner or later, someone who's caring for someone with Alzheimer's or with a dementia of some kind or other is going to have to put that person in a nursing home. Probably, unless they die of a heart attack or something else first. But the state can save money by extending that time that the person could stay at home, which they would prefer and the caregiver would prefer. They can extend that time by a small amount of $3,000 a year instead of $6,000 a month, which it costs to cost the state when they go on the state, which they will go on the state. There's no other way.
Juliet?
I think that's what I would tell the legislators too, that it's a very big cost avoidance program for the state. And when they're making these cuts, they don't always see the benefit of a certain program. They think, we're just cutting a bit off here. But I did the reckoning with somebody else the other day, that if you kept the 371 people who are waiting for respite care, if you put them all in a nursing home, it would cost nearly $750,000. So these small amounts of money that we're able to give, and we love I have to say one thing. I modeled, when I put the proposal in 1977, at the end of 1977.
77.
And I mean 97.
Oh, okay.
Sorry, 97. I had based the way we designed the pilot program on New Jersey. I chose a small state and said, what are you doing? And they had a respite care program, and at the time, in 97, they would do it. Theirs was $4 million a year. But we've stayed almost static for the last 18 years. This is a program that could really stand a lot more money in order to save the state money.
Well, if you're seeing this video and you want to be able to offer your stories, please come and visit my website, and we'll collect this information and share this with the legislative body. It's www.senatorhwang.com. And I want to thank both of you. You're both champions. You've both taken your time up here, and you truly are champions that are speaking for the people that are unable to come up. So thank you.
Thank you. We thank you.
Thank you.
No, it's an honor. It's an honor to hang out with both of you.